And it's saying prepare to stream live. Second. Got it. Good afternoon, everybody. Welcome, welcome, welcome. Good afternoon. And Happy New Year. It's the 16th of January 2022. I believe I'm still allowed to say Happy New Year. So Happy New Year to everyone. My name is Tonye Oburoh, and I am the founder and the CEO of Diabetes Consults. And I'm super excited to be hosting this event virtual. Hopefully we will go to actual in the future as COVID disappears. And I have three amazing, I was going to say four, but three amazing guests on here. And I'm going to introduce them. So obviously today we're going to be talking about managing diabetes, preventing and managing diabetes within the Afro-Caribbean society, African and the Caribbean society. I want to actually say just to my other counterparts who live with diabetes and are not of the Afro or the Caribbean ethnicity, that it's not a discrimination. Diabetes doesn't know race, it doesn't know color, it doesn't know size. It affects all sorts of people. And the essence of today is just to hone in on the African Caribbean society, just to highlight the things that actually makes diabetes worse within our society. That's the essence of today. So I'm going to introduce the speakers and then I'll let them talk. I'm going to start with Michelle. You are at the top of my screen, so I'm going to start with you. So Michelle, I'm going to summarize all of it. She's a former Great Britain Olympic athlete. Michelle knows what it is to reach to the top, and I can say that following her on Instagram. Beyond that, she knows what it's like to experience life outside elite sports as a successful businesswoman and a mother of three. Michelle draws on her own experience to inspire and encourage others in her work as a personal trainer, mentor, life coach, ambassador for Women's Aid, the Menopause Charity, and Diabetes UK. Jeez. Over the last 20 years, Michelle's passion for unlocking the potential of her clients has seen her success work with many celebrities, corporate companies. She revels in creating a climate of change to dream big and to achieve beyond your expectations with her guidance on well-being and having a balanced lifestyle. I've got big shoes to fill there. I'm going to go on to Folu. Folu is a wife, a friend to me, mom, they're all friends, by the way, and mom and GP. General practitioner, for those who don't know what GP is. She works as a salaried GP, also private GP, urgent care GP, as well as specializing in women's health with a focus on contraception. So if you've actually sealed the deal, you don't want any more kids, you go to Folu. She's a Christian and a trustee for her church. She's passionate about being active. She loves running. And completed her first full marathon 3 months ago. We supported her from a distance. And she did lots of races in 2021, including several half marathons. She has 2 children and loves spending time with her family, traveling and exploring new places. And last but not least, I do have Elloiuse. Elloiuse is a UK registered dietitian who specializes in diabetes care and weight management. She employing the use of functional nutrition, Elloiuse guides clients by adapting their cultural foods through meal planning, alternative cooking options, and creating healthy, sustainable lifestyle habits. She takes a holistic and realistic approach to help clients manage a wide range of health conditions such as high blood pressure, diabetes, cholesterol, you name the lot. And I'm going to add here, because I have a very long bio, Elloiuse breaks down the science of nutrition into easy to understand language. And she's written she's written for the national newspaper, Daily Mail, magazine, Women's Health UK, and regularly works with Diabetes UK. So I've got two people who work with Diabetes UK. I've introduced myself. So I'm going to kickstart the day, and to follow, I'm going to come to you. So everyone who is on here, we're just having a chat about diabetes within the Afro-Caribbean society. And we're just really trying to understand what makes us as Africans more predisposed to diabetes. Most people say that, the research has shown that Black people are 3 times more likely to get diabetes. But I'm going to start off with asking the question to you, Folu. What is diabetes?
Thank you, Tonye. Welcome, everyone. Diabetes, I think, simply put, is elevated blood sugars in the blood. However, we all know that it's way more complicated than that. And I think to really understand diabetes, we have to understand the way our body processes the food that we eat. So I'll say that very quickly. When we eat food containing carbohydrates, so starchy foods, some fruits, milk, some types of dairy, it goes into the body, it's broken down into glucose. Glucose is a kind of sugar that the body uses to utilize for energy. When the body senses that the glucose level is going up, it tells the pancreas, which is a small gland that just sits below the stomach, to make insulin. Insulin is that hormone that is made by cells in the pancreas, certain cells in the pancreas, that makes the sugars, the glucose circulating in the blood, to be absorbed into the cells of the body that need the energy. Now, the insulin, if you like, is like the password. It opens the doors to the cells for the glucose to go in. In diabetes, that system is broken. Depending on the kind of diabetes, which I'm sure we'll go into later, the insulin cannot function properly, or the insulin is not there at all for the glucose to go into the body. As a result, there is excess glucose circulating in the blood, and this is what causes all the symptoms you have in diabetes. So for instance, when the body senses that the glucose is too high, it tries to get rid of it. The kidney is working really hard to excrete all that excess glucose. In that process, it's taking water along. And so people with diabetes can feel the need to pass urine more frequently because the kidney is doing that job. Also, they get thirsty because also they're losing all that excess fluid. So the body feels the need to drink more. Sugar is coming out in the urine, so people with diabetes can have thrush. Because there's excess glucose in the blood, wounds don't heal properly because glucose shouldn't be circulating at that level, at that amount in the blood. The excess glucose goes behind the lens of the eye, so some people with diabetes can have blurred vision, but also it can cause a complication of diabetes. So those are some of the symptoms that can occur as a result of the excess glucose. But of course, I'm sure we'll talk more about how these things can happen in diabetes.
Thank you. Thank you. Very well put. It's I get a lot of the time people say to me, it's just sugar. Why are you stressing about diabetes? It's sugar. I'm just going to stop drinking Coke. I'm going to stop putting extra sugar in my coffee. So what is the fuss about it? So I'm going to come to a non-clinician, Michelle. To you, like I've just said, what most people who live with diabetes, what they say to me. To you as a non-clinician, because Elloiuse, myself, and Folu are all clinical, what do you understand in a layman's term what diabetes is? Anything different to what Folu has said?
Well, first of all, I have to just say that, Folu, thank you so much for explaining that to me. My mum was a ward sister who's also diabetic. My grandmother died from diabetes as well. And I've never had it explained to me so well. So thank you for that information today. And when you break it down that simple, I think that's what we more need to hear more about. So for me, I would say I would agree with Folu in terms of, I'd say the simplistic layman's term, because that's who I am. It's just that my pancreas isn't functioning properly. Yeah, and me being pre-diabetic means that if I continue the lifestyle I was living prior to being diagnosed in 2018, I'd be type 2 diabetic. And you're looking at me I'm a fit Black woman, but genetically I have got it within my family. My mother, my maternal grandmother passed from it. My father had it as well when he died. Also as well, my 3 first cousins, female, have it as well. So it's very prone within my family. So genetics plays a huge part for me. So all I know in the simple terms is that my pancreas wasn't working as well as it should be. That's my simplistic version of it all. And I had to do something about it by making lifestyle changes.
Okay. Thank you. You know, you just touched on the word. Elloiuse, I'm coming to you. You just touched on the word pre-diabetes, that you are pre-diabetic. And thank you for actually sharing that, because not a lot of people are comfortable to share that information. Now, Folu, you explained what diabetes was. So what is the difference? Michelle has just said pre-diabetes. People are like, pre-diabetes, diabetes, what is the difference? What is the difference between pre-diabetes and diabetes?
Yeah, thank you, Tonye, and thank you, Michelle. Yeah, that is really, really important, because actually that is something that if we're more aware of, particularly within the Afro-Caribbean community, we can make a lot of changes. You know, it's basically like we say, is the precursor to something happening, isn't it? So lots of places around the world will call it different names. Here we also call it non-diabetic hyperglycemia. So the glucose level is high, but you're not diabetic yet. So it's that stage between having normal blood sugar levels and having diabetes. So when we check the blood levels in surgery, for instance, and you are at that point where it's not high enough for us to make a diagnosis of diabetes, but it's not normal either. And the good news about it is that up to 50% of people that are diagnosed with prediabetes can have it reversed or delayed. So, it's really, really important that we all know our risk, which is something that I know for those of you that work with Diabetes UK, I know the website is really good. You can assess your risk online, and you can ask your doctor for a blood test to check if you're pre-diabetic. And, it's something that can be halted or reversed, or at least delayed for as long as possible.
Okay. One person has been quiet on here, Elloiuse. I'm not going to keep you quiet for too long. I'm going to come to you being a specialist diabetes dietitian. Now, we've talked about diabetes and pre-diabetes. We've gone through the whole thing. We've talked about genetics playing a part in diabetes. Now, is there something that we can do? So I'm going to throw two questions at you. Is there something when someone is pre-diabetic that they can do to stop them from going into diabetes? And if they do have diabetes, is there such a thing as a diabetic food? Because people keep saying there's a diabetic diet. You have to follow a diabetic diet. Is there really such a thing? So two questions. First one,
two questions.
Yeah.
Okay, so if we think about the first question, in regards to pre-diabetes, and is there anything you can do? Yes, there's a lot of things that people can do. And first and foremost, everyone's individual. So someone's journey may be different from another person's journey. And that's really important to consider, because, we all have the auntie and the cousins WhatsApp groups and things like that, with all the potions and things like that they are spreading along the way. It's great to get some moral support from family members, but if we start delving down into the science of it. So one, if you're pre-diabetic, it would be looking at how active you are. Okay. And I normally say to the people that I work with, I want you to be active throughout the day, not just go to the gym for half an hour or an hour, work hard, and then do nothing more for the rest of the day. I want you to try and be more active just generally throughout the day, because you will be surprised how much that can increase your step count and how much calories you're going to be burning. Also, then it's having a look at what you eat, and that's where a dietitian really does come into play. Diabetes UK do have some wonderful things that you can start off by just having a look on there and trying to make adjustments yourself. But if you are struggling, speaking to somebody, like myself would really help. It would then be looking at, I normally start off with looking at the foods in your diet that you don't really need. Okay, so let's call it the junk foods. Okay, so if that's something that enters into your diet, after breakfast, after lunch, at 3 o'clock, you get that 3 o'clock slump, and after your evening meal, maybe start cutting back, start making some adjustments there. It's a journey. It's not a destination. It is really, really a journey. And if you can kind of think of it like that every day you're just trying to put your best foot forward, you will get there. Okay, so pre-diabetes, you know, it's looking at how active you are, looking at what you're eating, and then if for some people, because not for everybody, there may be some weight loss that's involved in it as well. So that's pre-diabetes. Okay, now this next question makes me smile. I don't know why, because I just think it's such a marketing ploy. There is no diabetic foods. No diabetic food. To be honest, I could stop the conversation there. That's it. But we won't. There's no diabetic food. So if you go to the supermarket and you see chocolate for a diabetic, please don't buy them. You don't need them. A lot of the time they're laced with sweeteners that may make you go to the toilet a little bit more often. So you don't need them. Secondly, you know, if you go onto Google and put diabetes and diet, so many things are going to come up. When really, if we rewind and go back to the foundations, it's a healthy diet, you know, looking at how can we create that healthy diet for you. So as I said before, with the pre-diabetes, if there are things in your diet that you're over-consuming in, I normally say to a lot of my clients, you know, when you're eating too much of something, you know, if you're eating too much crisp, you don't need me to tell you. I want you to sit, I want you to reflect on your day. It may mean writing down what you've eaten, because when you write it down, it's going to really clock on in the brain, isn't it? You're going to see, oof, I've had 4 digestives today. I've had, you know, you're really going to be able to have a look at it like that. But then as things progress and, you know, we really need to tighten the belt, we could start looking at, you know, your carbohydrate intake, calculating how many you're having, and then working with a dietitian to reduce how many carbohydrate you're eating if you're eating too many. It's a very difficult question to ask in regards to a diet for someone living with diabetes, because it's not just the carbohydrates, or it's not just how much fat someone's eating. You have to look at the big picture, you know, and that's the reason why I always say it is a journey, because we just every day chip out and work towards, you know, the better, the healthier diet that we can create for you as an individual.
Thank you. Very well put, I must say. And now you did talk about keeping active through the day, you know, rather than just going to the gym. So I'm going to come to you, Michelle, because obviously that's what you do. Now, I would just give an analogy in my home. I got my little girl the watch that gone blank. That's it, a smartwatch for Christmas, for her birthday rather. And it's now become a competition in the house, who does more steps. So by 6 o'clock, she would diligently come and check your watches and say, how many steps have you done? Now that has now made me, because I even though she's a little girl, I want to compete with her, you know, and I don't want to keep getting mom is the loser. And I will consciously get up to call my patients in now rather than trying to press a button, because I want to move a little bit more. But I know that some of us have jobs where we can't really move and we're constantly stuck behind the computer. How do we now, Michelle, encompass that moving through the day, as opposed to just spending an hour or 30 minutes in the gym? How do we put all of that together and keep ourselves as active? How do you do it? Obviously, not all of us are ex-Olympic people, but for the layman, how do we get ourselves moving?
Well, I think your daughter's great because she holds you to account, which I love. You know, and you know, I did a collaboration with Fitbit and Diabetes UK, all around movement, you know, and doing the 1 million step challenge, which was fantastic. And even with somebody like me that's really fit, that held me to account, because I didn't finish the day until I'd done my 10,500, 11,000 steps, and that was just your basic steps. Forget me going to the gym or anything else that I did, dancing, anything else I do. That's just your basic, that's your baseline. So I would say with the way work is at the moment for a lot of people working from home, so actually missing out on walking to the train station or catching a bus or whatever, things have changed significantly. So what I've said to my clients as a life coach, I say to them, what could you do throughout the day? Yeah. What do you owe yourself throughout the day? We all have to invest in ourselves. It doesn't matter how much any of us here are giving advice to other people. If we are not looking after us, how can we give to others? So I'd say to people, right, after 2 hours, get up and go for a 15, 20-minute walk. The same way, like, no discrimination here, but we have to call it out. People that smoke would be out that front door having a cigarette, tallying up that time, and nobody bats an eyelid. But we now, as let's say, call ourselves non-smokers, we want to stretch our feet, have an exercise, give a good stretch. Give yourself 10, 15 minutes every 2 to 3 hours. And that, what that does for you is, apart from doing your steps, keeping moving, keeping active, it's also as well allowing you some time to reflect on yourself. And I, you know, I could talk all day to corporate companies. Investing in your staff, you will get better productivity. Yeah. And I say to mothers, women, wives, investing in yourselves, you will get better productivity for others. And my simple statement, I've even got a cup made from it. You can't give from an empty cup.
Mm-hmm.
So every 2 hours, get up and do something. Yeah. Keep moving, stretching. People might look at you and think you're odd. But you know what? Start the trend. It's a good one to start.
Yeah, thank you, Michelle. I think the other thing for clinicians that I've started doing as a practice, and I hope to continue, is as clinicians, you have blood tests to review, follow with a test to that, you've got letters to go through, all these things are flying at you. And the last thing you want to do is to leave your desk, because you've got your lunch and you're eating and you're trying to do that.
Yeah.
So what I've made a note of every other day, at least not every day, because otherwise I'll be behind, is to eat my lunch at my desk and then use my lunch period to go for a walk.
Mm-hmm.
You know, so you get half an hour or 15 minutes, just walk around. So eat at the desk and then take my eyes off the screen. So I have my trainers now and I've been doing it. I just eat and then I just go for, even if it's 15 minutes. So on Friday, I was like, oh, I only did 15 minutes, but I moved in 15 minutes. Now I'm going to come back to you, Michelle. A lot of us can start, and I'm one of them. I'm good at starting, but how do we get ourselves to continue? Because you've actually talked about you can't give from an empty cup. Because I know, and this is no disrespect to any of the Africans or anybody logged on here, we're the least people to move. You just want to sit down. We want to eat our jollof rice or rice and peas and chicken, and we just want to chat. We don't move. How do we, you know, become or remain consistent? Because there's one thing to move. We're in January, we're doing this in January. Everybody's got goals. I want to lose weight. I want to do this. I want to do that. And come March, it's under the pillow. How do we remain consistent, you know, to try and reduce this risk to diabetes?
Well, you know, again, I say not everybody can afford to, and I'm not, you know, I'm not putting it out that everyone should invest in a life coach like myself. I'm not saying that, or a mentor. You know, but what I am saying is find that friend that can hold you to account. We've all got somebody who's on this very similar journey as ourselves. So find that person and say, do you know what, Tonye, I want you to come with me. I want you to, babe, we live so far away. I tell you what, after you finish your 20 minutes, can you check in with me? We scroll through WhatsApp, social media, and waste a lot of time. Let's be honest, I'm one of them fools too, you know, that waste a lot of time. What's wrong with me checking in? T, have you done that? Yes, Misha, I have. Okay, I'll check in with you tomorrow. How are you getting on? And we make a pact with each other, almost like a marriage pact. Let's support each other. And we've got to be honest here. We more than ever, Afro-Caribbean people, need to support each other. We need to support, educate each other. We need to champion each other. And there's no better time than now to say, right, this is not just till March. This is not just to get a summer bikini body. This is a lifestyle change.
Yeah.
And I think that's the important word there. You know, I'm on here with two brilliant doctors, a brilliant nutritionist, a brilliant dietitian. Yeah, together we are stronger. But let's find that person and say, right, hold you to account. Help me out. I need you to help me with this. We all need each other.
Yeah, thank you. That's a really great thing, you know, you said, because we do need each other. You know, we're with each other for other things, but I think in terms of health and accountability, we're not very good at being with each other. And I can say that Folu is my friend and my neighbor, and I know she's going to be knocking on my door and carrying me. So I'm holding publicly myself, and I've got a few other friends and sisters on here that would hold me accountable. Now, I want to reverse a little bit, because we've gone off, you know, like talking about the diet, and I'm going to come back to you, Elloiuse. Folu, we've talked about diabetes, and a lot of people put diabetes in one box. You know, like I did a video the other day. Somebody put on my post, I put a post, and they said, get treated with herbs and your diabetes will get better. I don't want to answer that. I just deleted that post. I deleted that comment. That's the only thing I'll say. Now, I'm going to ask you, what are the types? Because there's so many types, but again, so probably Michelle doesn't, or maybe she does work in Diabetes UK. What are the types of diabetes that we have out there?
Yeah, thank you, Tonye. That is a really important question. There are lots of different types of diabetes. Now, I know your focus is probably going to be on the two main types, the type 1 and type 2 diabetes. But there are other types there as well that we need to be aware of. So I'll talk briefly about the important ones and just mention a little bit about some of the other ones. Type 1. Type 1 is where the body produces things that stop the pancreas from working. So essentially, the cells that would cause the insulin to be produced are destroyed by the body itself. And this is usually diagnosed in young people. So most people under the age of 40 that will be diagnosed with diabetes would have type 1 diabetes. Now, that's not to say other types are not diagnosed in people under the age of 40. It is diagnosed. The main thing with type 1 is that most people that are living with type 1 diabetes, no, in fact, all people that are living with type 1 diabetes will be on insulin because they don't have insulin at all. And that's an important distinction to make, because I know we'll probably get to this, but insulin is one of the things that causes stigma and that a lot of people are reluctant to go on when it comes to diabetes. So, we're talking about how glucose is produced and how insulin works and the rest of it when I was talking about diabetes initially. Now, in type 1 diabetes, because there's no insulin at all, the glucose continues to rise and rise and rise and rise, and there is no insulin to actually let this glucose into the cells of the body to make energy. And so they start to develop those symptoms that we talked about earlier on. Except in children, it can be really hard to make that distinction. So a lot of times, if I see a child, there's really no clear explanation for why they're so tired, because obviously the glucose is not making energy, or why they just unwell, or I always check their blood sugar level, because you never know. And, by that, we've made a few diagnoses of diabetes. A lot of times when children present, unfortunately, they present when they're already in complication, which is a real shame, because parents don't often know what to look out for as well. Now, type 2 diabetes is slightly different, because that often results from either there not being enough insulin, because the pancreas is not making enough, sometimes because the cells have been taken over by fat cells, or there is insulin, but the body is not responding to it as it should, what we call insulin resistance. So there is insulin, but the body isn't responding to it. And there are lots of factors that can cause insulin resistance. So those are type 1 and type 2. As you know, the symptoms are the same because, again, the body senses the excess glucose and starts to produce those symptoms. Now, there are a few other types that we should be aware of. So there's gestational diabetes, which develops in pregnant women. And that resolves after childbirth. But the risk is that people that have had gestational diabetes are more at risk of developing type 2 diabetes later in life. So it's important for them to have yearly checks, at least, to check that they're not developing diabetes. There are a few other ones. Another important one, which I would mention only because, again, it's really important to know, is what we call type 3C. And this is when other conditions destroy the pancreas. So it could be something like cancer of the pancreas. It could be pancreatitis, which can often result from people that drink excess alcohol or have gallstones, which then affects the pancreas. And so the pancreas, again, is not functioning as it should, is not producing enough insulin. And a lot of times, patients like this can be diagnosed with type 2 diabetes, whereas we're missing the primary problem, which could be cancer, which could be pancreatitis. So in older people, when they come with weight loss and we check the blood glucose or blood sugars or HbA1c as we do now, and it's raised, we should be thinking, what else can be causing the symptoms of diabetes? So those are some of the types. As Tonye knows, there are lots of types. There are some that are associated with syndromes, some with medications like steroids. People that are taking steroids for a prolonged period at high doses can develop diabetes. So a lot of things to be aware of, but the most common ones are type 1 and type 2. About 10% of people in the UK with diabetes have type 1. About 90% have type 2. Unfortunately, more and more young people are developing type 2 because we're becoming more overweight, and having children are becoming more sedentary, and all of these things that increases the risk of type 2 diabetes.
Thank you so much. It's so hard to cover all these things in such a short time. It's one thing you said, very well put, Folu. It's one thing you said, about children, because the youngest child, I think, that we've seen with type 2 diabetes was 10. Mm-hmm. 10-year-old with type 2 diabetes due to weight. So it's not just, obviously, like Folu, if you're clinical here, we normally say you need to think at the back of your brain every time a person living with diabetes or a patient presents to you. It's not just a stamp type 2 because no, they're over 40, they're old, so it's type 2, or they're young, so it's type 1. We kind of need to do further investigations. And I always say, for people who don't live in England, and even people in England, you have to take responsibility for your own health. Because most people say to me, my doctor hasn't called me, so I've not gone for 2 years. Your doctor is not living with diabetes, you are living with diabetes, or you are at risk of diabetes. So if you know that your grandmother or your great-grandmother, like Michelle said, or someone in your family has got diabetes, just ask for a test once a year, at least. We're not asking you to go every 3 months, once a year. And then if you live with diabetes, please know what your targets are. Because sometimes I speak to people, especially within our culture, and I say, okay, they say, help me, I've got diabetes. Okay, what medications are you on? I don't know. Or what is your target? Is there a target? I don't know. And I think obviously it's lack of education. We need to obviously say to the doctor, what is my target? Where am I at? Where should I be? How do I get to where I need to go? These are the simple things that I say to people when they present in front of me. So thank you, Folu. And I'm going to add, I think there is no, one diabetes is not more important. It affects everyone the same way. Another one that we talk about is what we call latent autoimmune disease of adulthood, which is LADA. They often present as a type 2, like Folu would say, but most of the time, when their blood sugars are not controlled and you're treating them, there are some tests that they need to, most times it's hospital-led, that need to be done to find out, do they really have type 2 or are they something else? Because otherwise, we're just leaving them in that state that they shouldn't be in. I'm not going to go into the different types because in the previous things that we've had last year, the years or the months before, we've covered the different types. If anyone has missed it or has more, questions around type 1, type 2, please visit our page on YouTube and you can catch up on the different types of diabetes. Now, Folu, I'm going to come back to you and then obviously throw it to Elloiuse afterwards. People, like I said to you, someone said, have herbs and you'll be cured. Is there a cure, or is there, later on, Elloiuse, a diet that would cure diabetes for everybody that has diabetes?
Oh, Tonye. Unfortunately, the short answer for that at the moment is no. Of course, we've talked about different types of diabetes. We know for type 1, there is no insulin at all. They do need their insulin. For type 2, we talk about what we call going into remission. Mm-hmm. And we use, that is really important. That distinction is important because we still want patients to carry on having all their checks, all the, routine checks, food checks, eye checks, blood tests, all of it. Mm-hmm. Because when you're in remission for something, as we all know, it can come back. So with type 2 diabetes, diet, weight, as I'm sure Elloiuse and Michelle will talk about, exercise, all of that can push the blood sugars back into normal range. Mm. And people with type 2 diabetes can be able to stop medications at this point. But it's really important that they still have all their checks done as they would when living with diabetes.
Mm-hmm. Thank you.
I should say, because science is advancing every day, there's there are lots of research going on, looking at things like stem cells, looking at things like vaccines even, that might be able to mean that we can transplant the cells that produce insulin in the pancreas, and which would mean that there would be a cure for diabetes. So who knows,
Until then, talking about advancement, I heard about a gentleman in America, apparently, who had a modified pig's heart inserted into him recently, and he's doing well. So again, we don't know where diabetes goes in terms of the treatment, but as of now, there is no cure. Like Folu said, type 2 goes into remission. Doesn't mean you're cured, because people go, I'm cured, I don't need to go to the doctor again. Please go and have at least your blood test. Now, Elloiuse, I'm going to come to you, sitting nicely and quiet. I'm saving you for the last, because I know most people have got questions for you. Now, our diet. I like jollof rice. People like fried rice. They like rice. I don't know what your favorite food is.
Curry goat and plain rice.
Pardon?
Curry goat and plain rice. My favorite.
Curry goat.
Yeah, she likes curry goat and plain rice. We have yam. We have cocoyam. How do we, because once you have diabetes within the African community, after screaming the name of Jesus and every other thing they want to scream, they say to you, don't eat any of this. Just cut it out. You see people being given vegetable. How do we manage our Afro-Caribbean diet and reduce our risk of diabetes, or making the diabetes go worse, Elloiuse?
Yeah, okay. Well, first, let me just say this. Your diet, if it's an African diet, Caribbean diet, whatever your cultural food is, it's awesome, okay? You do not need to stop eating your food, okay? You've been eating it, your forefathers have been eating it. It's good. It's good food. But then there's a bit of a but, isn't there? It's all to do with, how much of it are we eating? And also, how are you preparing it? And really, if we focus on how are we preparing it first, that's going to take us a long way. Okay, so Michelle said she likes plain rice. I would say to somebody, what type of plain rice are you going for? Are you going for long grain? Are you going for basmati? And if we were comparing the two, I would always say go to basmati. And the reason why is because when you eat your basmati rice, the makeup of it, it's going to digest a little bit slower than the long grain. And I think we talked about it earlier. This is all to do with that foundation knowledge, reading evidence-based information, going on trustworthy websites, say like Diabetes UK, to get some real good knowledge. So yes, we can eat our food. So then if we're going to think about frying that rice, we're going to have fried rice, or we're going to have rice and peas, and we're going to be adding some coconut milk and things like that. Culturally, we have these foods, don't we? But how often are you having them? Yeah. If you're having them once a week, okay, then we would say, fine, we can incorporate it, but how much of it are we incorporating it? If you're having it, say, 5 nights out of the 7 days, then really that's your go-to food. And we might need to make some changes to that, okay? I have got a book here. Yeah, I don't know if anyone has ever seen this book, Carbs and Cows, but then there's the World Foods version. There are also just the general, the Carbs and Cows general one, but the World's Food one is really good because it does have our food in there, okay? So we've got things like, we've got fufu, yeah, we've got fufu there, and then we've got the very special, which I think this needs like a national award, plantain. Don't you think? Because everyone loves it. It needs a national award. Everyone loves plantain, okay? Now,
that's our gold medal right there. That's our gold medal.
It is, isn't it? I'm not going to get into the conversation of how you cut your plantain, because I have realized everyone has their own way of cutting it. I'm a slanted cutter. Yeah, I've got to cut it slanted.
How with you?
Yeah, and some people cut it straight. Okay, so if you are choosing to have plantain, and you do want plantain, and you do want it fried, maybe it's with your Saturday breakfast or something like that. Again, how much of it are you having? Because to be honest, I think everyone just generally has too much because it's moreish. Okay, so it's finding your sweet spot, you know, having just enough to satisfy you, but not that much that you're overindulging. Michelle said it earlier, where she talked about the cup, you know, your cup runneth over. Is your cup full? Are you looking after yourself? So I would say to someone, you've got your food, you absolutely love your cultural food, right? Okay, but let's not overindulge in it. You can have it again next week, or you can have it again even tomorrow, but let's reduce your portion sizes. Let's reduce your portion sizes. Tonye, what was the question? Have I missed anything? I think I may have.
So you just led me onto something else.
Okay.
And I'm going to come back to you, Folu, around diabetes later. You led me to something else that I was going to ask you much later, but now you brought it up. Is how do we tackle, and probably this will go to Michelle, how do we then tackle people not feeling full? Because I've had patients who've said to me, you give them, there's some portions that, you know, like my father would say, are you serving the chicken or you're serving the cow? You know, and it's a true African, you know, like we've been brought up to eat a lot. You know, we've been brought up to eat a lot. And I've had a few patients say to me, you're telling me to eat half the plates, vegetable, that's not going to fill me up. So as a dietitian, how do you advise us to deal with, one, the binge eating, and two, the portion sizes? Because if you go to parties, have you been to those African parties where they have those trays and then they keep hipping it on, and then you have amala on one side, the rice? How do we deal with that?
Okay, now, if we do talk about binge eating, to be honest, that is a whole category itself, because there's the mental element that comes to that as well, isn't there? There is the why, you know, and the why is massive. You know, when you have your meal, but then you automatically want something sweet. Why? Sit down and just reflect and think about why. Is it a habit? Okay, so we all do habit stacking. So for example, you may go to the bathroom in the morning, you brush your teeth, then you go in the shower. These are all habits that you've created where your brain doesn't really need to think about it, because you naturally do it. Have you ever driven to work and think, how did I get to work? Because I don't think I really focused, you know, I just arrived. It's a habit. It's something that's ingrained in you. And a lot of the time we have something sweet after our meals because of that reason. Is it stress? You know, are you stressed? I realized when I was studying as a student, I would reach for a packet of Maltesers, and I had to ask myself, why do you keep doing this? And that was the way I, you know, dealt with my stress of, the assignments need to be, you know, handed in, or I just feel a bit pent up. So there is the why. But binge eating, there is also more to it, and you might need to get some talking therapy. You may need to get a life coach. You may need to start doing some self-reflections and thinking about, you know, why am I overeating, or why do I eat when I come home from work? Why do I sit and I gorge myself? But then from also a nutritional point of view, what I do find is sometimes people can be really good throughout the day. And when I say good, it's they've had a small breakfast and they've had a small lunch, and then they come home in the evening and that's it all goes in. And really it's because you've not nourished yourself well throughout the day. Does your meals consist of carbohydrates, some protein, some healthy fats? Are you incorporating fiber? Fiber is underestimated. We need it to help, you know, bulk things out, you know, also for our digestive system and all other things. So it's then having a look at your meals. How are you creating those meals? A lot of our meals culturally are very carbohydrate heavy. You know, if I think of it from a Caribbean point of view, on a Saturday, you may have, we call it food. So food is yam, same as an African. Yam, and then you got your dumpling, and then you've got your green, you got your green banana. You might have, what is it called? Cho-cho. Yeah, you got it. Okay, so all of these things they're carbohydrate, real heavy, and then a bit of protein. And then what you find is a lot of the men in the family, they'll eat and then they sleep. Yeah, and that's because your blood sugars have shot up, and then your body's working really hard to bring it back down to that homeostasis, to that balance. So portion sizes, looking at what's on your plate. I say to people, if you like, we could literally draw a picture, just like at preschool, draw a picture, you know, of a plate, this is protein, this is some healthy fats, this, and we can stick it on the inside of your cupboard, and ever so often you just take a look. Does my plate look like this? Yeah. And then you'll find that you won't feel as hungry as you think you do, because your food's more balanced. Secondly, put my teeth in. Secondly, hydration. Yeah, I know a lot of us do think we drink a lot, but if you ever try and give yourself a bit of a hydration challenge, get yourself a bottle, fill it up, say about 2 liters, see if you can get through it. You may be surprised that you don't, So as I said before, it's the big picture. It's looking at every aspect. And then it's the mind, Tonye. It's the mind. A lot of the time we're stuck in a rut. We've been doing something the same way. You've developed this pattern from your parents and your family, your nan, and that's just the way you think it is. I'm not saying their way is wrong, but you may need to make some adjustments to what your plate looks like.
Right.
I love that.
Yeah, thank you. I think this session is not one that we can cover everything that relates to the Afro-Caribbean society, because we're not a problem. We're just a great community that need help. That's the right way that I want to put it in. Now, I'm going to come to Folu and then Michelle. Religion. We have Muslims, Christians, Buddhists. They have Buddhists in Africa. But anyway, yeah, we have so many different religions. And you get those people who are, in terms of their religion, who get told they have diabetes. First of all, it's very difficult for them to accept it. Secondly, they say, I'm going to go and pray about my diabetes. So even when they're showing symptoms and you're telling them they've got diabetes, they're refusing to take medication because of a belief that they have. Is there a way in which we handle, because we don't want to be judgmental, because we're not being judgmental to them. There's something they believe in. How do we help these people to see what exactly is going on the inside of them while they're praying and believing to whichever God that they pray to? How do we then help them in terms of their diabetes? Do you have an answer?
Oh, Tonye, that is a really, really important question. And I think a lot of it is also really deeply rooted, not just in religion, but in culture as well. Just some of the things that Elloiuse said, I thought was really important about the way we're brought up with food. You see kids being forced to eat and clear their plates, because you can't let food go to waste. And so they end up getting their stomachs expanded because they just forced to eat more and more and more and more. And there's that obsession with making sure you're, you look healthy as a child, which is just basically looking chubby, isn't it? If you look skinny, everybody that comes to your house looks at you like, what you feeding this child? And it's the same when it comes to having a medical diagnosis and medications. A lot of people, there's a lot of stigma around accepting a diagnosis, be it high blood pressure, diabetes. So sometimes I look at it and I think, is it actually religion? Yes, maybe some religious aspects come into it. For instance, some people won't use certain medications because they contain animal products. Some people, their religion would say, I know some Muslims would not take certain things because of or some medications because of what it contains. And some Christians just simply cannot accept having a diagnosis. But if you look through the Bible, if you look through the Old Testament, I'm a Christian, and I know there were examples of herbs, which is what have now been developed into medicines, where they were used to treat medical conditions. And I always say to people, I believe God gives scientists the knowledge to develop these things. So why won't you use them? So it's not about judgment. First, we need to remove all the stigma around these conditions. It should not be stigmatized. We can accept it. We can work together. If I have a friend that has diabetes and I am aware of it, then I can encourage them. I can hold them to account, like Michelle was saying, with things like keeping a healthy diet, keeping a healthy lifestyle, moving, but if they won't even tell me, how do I know? And I think that's point at which we are in most of our African and Afro-Caribbean communities is that we don't even want to accept. But and if we need to come to the point of acceptance first, then we can accept the help that is on offer, and we can work together as a community. So I said to people, if you have specific concerns, okay, so is it about certain medications? Is it certain types of insulin? What is it? Speak to your medical professional, speak to a healthcare professional, because believe it or not, there is always an alternative. There is always an alternative. But accepting that diagnosis of diabetes, that is the first step. And you need to please, because we often see people with complications, and that's the point at which they come. And you think this is preventable.
Yes.
Because it really is preventable. So we need to, as a community, take away the stigma around it, accept it, and work together.
Love that. Thank you. Thank you, Michelle. I'm going to come to you. Again, I just feel like this hour has just flown by and I've not even gone through anything that I wanted to ask, but obviously all good things come to an end and we can always throw another one later on in the year. But Michelle, do you have anything to add to what Folu said about faith or religion, coming from your perspective, because you deal with people and you're a health coach? What would be your encouragement, to people in terms of taking medication or getting treatment for something like diabetes?
I think the first thing, I'm an ambassador for Diabetes UK. I'm also an ambassador for the menopause charity as well. Again, something there's a lot of stigma around it for Black people. Let's be honest here. And it's historical. This is what we have to understand. It's historical. It comes from our mothers, our grandparents, where you was always told, don't tell anybody your business, keep it to yourself. So we, first of all, exactly what Folu said, and I was, nodding so much my head was going to rock off. I applaud you, Folu, for really emphasizing, let's remove the stigma. Yeah. And we've all got our faith, not all, some of us have got faith that we strongly believe in. However, we mustn't allow ignorance to allow us to fall into the trap of no return. Yeah. And like we said, preventative, a lot of it is preventative. Yeah. And we often look at people and we think, gosh, it's so sad that happened to that person, because had they been open, they could have reached out to the Folus, the Elloiuse, the Tonye, to get the support they needed, all just with a simple question. Yeah. The thing that we have to recognize is none of us are exempt. None of us are exempt from anything. And so there's no shame in anything that we have. I was not embarrassed when I was told that I was pre-diabetic. I was more shocked because of how healthy and fit I thought I was, But I think the great thing is, as a role model that I think I am, and I know I am, if it can happen to me, guys, take a look. It can happen to you. Yeah. So that's why I want to be putting myself out there to say, if I can be told, Michelle, if you don't fix up, you're going to be taking metformin. Then if I want people to say, gosh, if it can happen to her, it can happen to me. What is she doing? And exactly what Elloiuse said, why are you eating what you're eating? Why do you feel you have to overindulge? And again, we talk about historical again. Historical it is when you go around to your grandparents' house, your auntie's house, eat. What's wrong with your child? What is wrong? Why you're not eating? Yeah. And that's almost like it's almost a negativity around it, rather than saying, actually, the child's full. They're full now. Yeah. You're not after every meal you're going to have a pudding. We're not doing that. Yeah. We don't need to do that. Go and have a glass of water, and then later on we can look at and explore some options of eating better, because we know better now. Yeah. We know better now. Why are we not teaching better? Because we know better. Yeah. So we're not letting go of, I'm not letting go of my Jamaican Barbadian heritage for nobody. However, what I am doing is educating myself so that my daughters, who are more prone to diabetes because of me, my son that be more prone to diabetes because of me, I'm educating them so that they can then pass this message on and on and on. Yeah.
Well, thank you.
Tonye, can I add to that?
Yes, sure.
So it's interesting. I did a research project, and the title of it is, does the Christian faith influence the management and prevention of type 2 diabetes? So we held forums and everything like that. And one of the biggest things, one of the themes that came out was that when someone is diagnosed with diabetes, they feel the same. So they've gone to the GP, maybe for a cough, maybe for just a general blood test, and now they've been told they've got diabetes. And because they feel the same, and they have no symptoms or anything like that, they think, you know, I don't really need to do this, or I don't really need to do that. And I get that. I really, really get that. Because if you feel exactly the same as you did yesterday, you know, but now today someone's telling you to take metformin and other kind of medication, you're going to think, I don't need it. But as Folu said, if you do, you know, really, if you are leaning into your faith, whichever faith that is for you, start digging deep and having some good reads, because there are scriptures out there that do talk about this. You know, our body is a temple and we really need to look after it. Okay. There are physicians that have been put here to help you and support you. And also by supporting your health, by using Western medicine, doesn't mean you're less faithful, less godly, less godlike, or anything like that. Okay, these things are there to support you. And it is really sad to sit as a dietitian. I also do a joint clinic with podiatry, to sit in those clinics and to see the amputations that have happened. And believe me, sometimes I just sit there thinking, I wish you would just listen. But then I also understand that there's also a mental element of it, and the society and all the other things that are going on in someone's life. So it's not just as simple as me sitting there saying to you, don't eat this and don't eat that. That is not what a good dietitian would do. You know, it's a lot of counseling, and it's a lot of whys and a lot of reflections and a lot of thinking about, you know, how did we get to this point and how can we improve it? This is an awesome conversation.
I'm gonna probably end this session because we have 1 or 2 questions. I did ask people to send me their questions, and 2 people have sent it in. I'm conscious of time. I'm gonna end it with you, Elloiuse. A lot of people send me messages and say my blood sugar spikes. These are people that have diabetes, you know, probably on insulin, and they don't know what they're doing wrong, or you know, they feel like they're trying to eat what they can, but no matter what they do, their HbA1c or their blood glucose reading does not come down. Now, how do we incorporate things within our food to help stabilize our blood sugars? You know, and obviously help to keep them balanced through the day within our diets. Because when I say to them aubergines, they just look at me like, what? So obviously within our diet, how do we stop spiking blood sugars?
Okay, so the first thing I would look at, is, you know, take a bit of a food diary, write down what you're eating, okay? And if someone's finding that they're having a spike at lunchtime, we'd probably focus on that. Are you eating a large portion of carbohydrates on their own? And I know I'm saying carbohydrates like everyone knows what a carbohydrate is. So again, it might be thinking about, what is a carbohydrate? You know, it's things like your breads, your pastas, your rice, your cereals, also, you know, your yam, pounded yam, things like that. So are you eating a large portion of those type of foods? And then what are you eating them with? Okay, so if you're eating them with some healthy fats and some protein, what that's going to do is, you know, so say this is your blood sugars, you're eating the carbohydrates alone, it's going to go up, it's going to elevate, okay? And then your body has to try and work its way to bring it down, or the medication has to work to bring its way down. But if you eat that meal, but also incorporate the protein, because protein is harder to digest, the fiber, you know, fiber is really, you know, it's like I call it like a taxi. It goes into the body and it helps to pick up all of the bad cholesterol and things like that. If you're incorporating your food as a whole like that, rather than it just going up so steep, it's going to go up at a flat peak. Secondly, it's going to keep you a bit fuller for longer, because it's not just going to be like peaks and troughs. Okay, so it's really thinking about what is on your plate. You know, if that's the one message that a dietitian is leaving with you today from this meeting, is what is on your plate? Is it have you got your carbohydrates, your protein, and your healthy fats? And that's also the same for your snacks, because I find that snacks are predominantly carbohydrate based. You know, you might have a cereal bar, predominantly carbohydrates, a packet of crisps, carbohydrates made from potatoes. So how can we make it a little bit healthier? You know, try and invest in yourself. Maybe it's a day of the week where you can sit down and you can, you know, start preparing your own snacks. Get yourself some little bags, some little containers. You know, you could have some grapes, some what are they called? Some grapes and some almonds. Lost the words there. Yeah. Grapes and almonds together, because a lot of time we're snacking because we want to keep our mouth busy, you know, not necessarily because you're hungry. So something like that, you know, you can pick and you can keep yourself busy, but you're incorporating the carbohydrates, which is the sugars from the grapes, and also the protein from the almonds and the healthy fats from the almonds. Perfect little container to take to work and eat at 3 o'clock. But then also, if someone's blood sugar is continually spikes, it's also thinking about their life as a whole. So holistically, are you under stress? Because I can also give you good advice until the cows come home, but if your stress levels continually increase, you might find that your blood sugars are following that same trend, and you may need to think about, you know, your life, what's happening. Just before I came on here, I did a quick message on my Instagram, and I was talking about you have physical health, you have mental health, but you also have spiritual health. Doesn't matter. Spiritual health is different for us all, you know. But are we looking after all three of those, or are we just focusing on the physical health, forgetting the mental, forgetting the spiritual? We are a whole person, you know, and we need to look at ourselves as a whole. So nutrition comes along with everything else. It's not just standalone. I know I'm talking a lot. Can I just go back to that remission question, Tonye? Yeah. So there is a lot of information out there about remission and following maybe an 800 calorie diet, or you know, lowering your intake to achieve remission. Yes, that's correct. There are information out there. You can get support from your medical team. But what I always ask my clients to do is also have a look at what will life look like after your 800 calorie diet. Because you can't stay on that for life.
Not sustainable.
Okay?
Not sustainable.
And
thank you, Michelle.
Yeah, and I find as a dietitian who has done remission projects and programs, it takes a toll, especially on women, on your mental health. Imagine you're size 20, you do remission. You're size 12, you feel good. Yeah, your HbA1c's come down and you're just like, whoa, great, life is good. But because you haven't learn how to eat, you haven't learned the foundations of nutrition, you go back to eating how you were eating before, what happens? You're now size 24. Yeah, so
mental health.
You know, sessions like these, the great things that Tonye is doing on her website and things like that, please continue to tune in, because it's a journey. You know, this is not a sprint, this is a journey.
Thank you, Michelle. Thank you. There was one question that I think that I was going to take in, and the other two was around abdominal fat, because most people, especially within our society, once you're of a certain weight, you get tagged out. Oh my God, you have diabetes. It's because you're of this size. And a lot of people forget that, well, yes, being overweight or obese puts you at a higher risk, but not everybody who is overweight or obese will get diabetes. But it's mainly around abdominal fat. Now I'm going to go to Michelle and Folu first from a clinical point. How does the abdominal, so when you have a big abdomen, or bigger abdomen than you should, how does that relate to diabetes? And Michelle, once Folu is done, how do we then get our stomachs to have a beach body to reduce that abdominal fat? Folu.
Thank you, Tonye. That is a really, really important question, because you're absolutely right. And that's part of the stigma around diabetes, isn't it? When people are diagnosed with diabetes, you have people that are really frustrated because, why should I have diabetes? I'm quite slim, you know, I'm not overweight. And then there are people that are overweight and they can't tell anyone because they feel judged already, because I think it's all to do with their size. We've already mentioned some of the risks that put you at risk, some of the things that put you at risk of diabetes anyway. Just having a family member, you know, your dad, your mom, a sibling, a child with diabetes means that you're 2 to 6 times more likely to have diabetes. Being African, Afro-Caribbean, Asian, even when you're slim, puts you at increased risk of diabetes. So, you know, it's not just about weight. But when we're looking at weight on its own, then yes, weight around the abdomen is more important than an overall increased BMI in terms of the risk of diabetes. So now when we measure, the waist, the risk at which that begins to matter for somebody who is Black or Afro-Caribbean or Asian is much more less than it is for other ethnicities. So, if your waistline is a certain number, you're already at increased risk, even though for somebody else of another ethnicity, they can be well over that and their risk is still much lower for diabetes. And why is that? Because often the fats around the abdomen are the most volatile. So anything can cause the fat to rupture. You cough, you laugh, you lift something. And of course, fats are living thing as well. It's a living thing. It releases abnormal cells, abnormal substances. I'm trying to put this in a layman language as much as I can without using
difficulty.
It releases all these substances that causes your insulin sensitivity to reduce. So it destroys the rate at which the body can respond to insulin. So even though you have insulin circulating, your insulin resistance is high. And there's something that we call metabolic syndrome. And that simply means when somebody has 3 or more of having a high insulin resistance, being overweight, having a high blood pressure, and having the bad cholesterol. So a higher amount of the bad cholesterol and a lower amount of the good cholesterol. And when you have metabolic syndrome, then that as a whole increases your risk of things like stroke and heart attack. So often being overweight comes into that. But there are some people that are overweight, but are metabolically healthy because they still have good cholesterol. They don't have high blood pressure. The insulin resistance is low because they don't have an excess amount of abdominal fat. So yes, it's very possible to be of a high BMI and not have diabetes. And it's very possible to have a normal BMI, have a little bit of, abdominal fat and be at increased risk because there are other factors that are at play. So I think if you're living with anything today, I know Elloiuse has left us with certain things. I know Michelle has left us with certain things. Please know your risk, know your family history. Those things that they don't want to talk about, check, ask for a blood test. And then you can start to take those measures. Let's do away with the stigma and let's start to take measures to support ourselves, to support our community, to reduce, because we're already at an increased risk just by having all this melanin.
Michelle, I'm going to come to you lastly, and then I would answer the questions because they're quite simple. How do we then, what things can we do? So Folu has said, obviously increased risk with the abdominal fat. What things can you advise us to do to be able to reduce that abdominal fat, mummy pouch, whatever we call it, love handles, whatever we call it, we have names for it. What can we do to try and reduce it? Because reducing it, even though marginally, will play an important part in our risk or treatment of diabetes. So do you have any advice on what we can do?
I can only talk from my point of view, and because like I said, I'm not a clinician and I don't pretend to be, I increased my fiber, my soluble fiber. I went on a higher protein diet that worked for me, and I upped my aerobic work. My cardio work, my working out. And when I mean working out as well, I mean like walking. So I'm not a walker. I would run, walk, jog, and start off slowly is what I say to people. The Couch to 5K. It's an app that's out there. And I think it's one of the best apps that's out there for beginners. Couch to 5K. And also, again, it allows you to track your journey. It's very important, for all of us on this call to start looking at the bigger picture, exactly what we've all said. So track your journey, track your progress. And remember, we are all work in progress. I'm work in progress. So cut yourself some slack from that. We're all work in progress. But for me, what worked for me was I went on a higher protein diet. I started to have more fiber in my diet. I'm not a big alcohol drinker. So if you are, maybe that's something you do look at, cutting right back. And I've always called it wasted calories, in my opinion. Yeah, I've always called it wasted calories. It turns to sugar, and that's what for me. But I'm bearing in mind I'm not a big drinker, so I'm probably not the best person to advise on that. Yeah, but that's the first thing that I would cut out. I'm an eater. I like food. Yeah, I'd rather have a big, nice portion of food than have a big glass of gin. Doesn't mean anything to me. But I would say to you, up your aerobic exercise. Also, as well, from a personal trainer's lens, weight training burns a lot of fat as well. Yeah. So when we're talking about the getting out and walking and jogging, if you can incorporate some form of weight training, which again is another conversation for another time, but explore your options, go and find out. There's so much on YouTube, so much on Google. Incorporate some form of strength training. It burns fat.
Okay. Thank you, Michelle. And we're going to have final words, but I'm just going to take on some of the questions. Someone asked, if someone is pre-diabetic and on medication, can they come off it? My answer is yes, if you're pre-diabetic. No, someone said if you're pre-diabetic and your doctors rushed you onto drugs, can you come off it? Because a lot of people have misconceptions that the doctors just want to throw medications at them. I would like an advocate for every doctor or clinician out there. We do not like to throw medications at people if we have a choice. We actually want to keep you off the medication. If we actually see that you need the medication or your risk is increased, we would encourage you, we wouldn't force you to take those medications. Going back to the question, if you are pre-diabetic and they've put you on medication, now it depends on how pre-diabetic you've been. If you're here in England, we monitor your levels at least every year. Some surgeries are good twice a year. If your levels within pre-diabetes, there is a range, keeps going up. You might still be pre-diabetic, but you're going up and you're heading towards diabetes, being diabetic, and you're getting older or your risk is higher. Your doctors might encourage you to start setting medications if they've tried the diet, because people say, please give me one more try. I beg you in the name of God, one more try. We have given you so many tries and the blood sugar is not coming down. In order for us to reduce your risk of diabetes, we would encourage you to be on medication now with close monitoring. If that level comes down, I don't encourage to stop on your own and you want to try stopping, we can have the drug holiday. But we close monitoring. Please don't do this on your own and quote me that I said that you can stop. We close monitoring, check your levels. And if they go back up, then please take the medication. Someone said to me, like someone died, falling into the sea and not knowing how to swim and screaming out to God saying, God, please send me a helper. And a lifeboat comes through and you say, no, I'm waiting to hear directly from God. The boat goes through. I think I sent this to you, Elloiuse. And then another boat comes and you say no. And then you finally die and you go to heaven and you say, Jesus, I asked for help. And he said, no, but I sent you boats. You just refused to get on them. We are your boats. We're here to help you, to guide you within diabetes. We're not just here to throw, an extra tablet or just put you straight onto insulin because we're trying to tick the boxes. There are boxes to tick, but it's actually mainly to reduce the complications. Another person asked on here, is diabetes reversible? It can go into remission, like what Folu said, but does not mean that it is cured. Remission is a bit like cancer, like Folu said. If you have cancer, they will call you for checks. So yes, your diabetes level may go down, or like in Michelle's case, her levels may be within the pre-diabetes or has reversed itself. Does not mean she says, goodbye, doctor, I don't need to see you again. She would obviously continue to have tests. So even though you're in remission or reversal, please make sure you take the ownership. Don't blame your doctors. Take the ownership to say, it's my birthday, make it a birth month. It's my birthday, it's time for me to have a blood test. Can I have, no, we're busy. Okay, I'll come back in a week's time. I need to have a blood test. He who shouts the loudest gets heard. And most, unfortunately, within our society, we don't shout enough. We just get told something and we go, okay, it's your health. Somebody said on here, when is the best time to check your blood sugar level? It depends on what blood sugar level we're testing. It depends on what you're on. It depends on what tablets you're on. If you're mainly the fasting blood sugar, which is the first thing in the morning, tells us exactly what happens. But sometimes we need to know what you slept with. We need to know what your blood sugar was before you went to bed to know what it is in the morning. But that, if you're doing a finger prick test, that is it. I'm going to quickly, before I go to last words from everyone, quickly say there are complications of diabetes, and I'm not going to be able to cover it. Hopefully through the year, I'm bringing on a urologist to cover the topic of erectile dysfunction, because yes, that is linked to diabetes. I'm bringing in a dentist to talk about your oral health and diabetes, because you can get complications from diabetes due to your oral health. We have podiatrists who are going to come on in the course of the year to talk about the diabetic foot and how to, stop the ulcers or the amputations like Elloiuse talked about. There's so many complications. I've said this before in one of the talks that we did, that diabetes is a bit like having a bucket of water and pouring a bag of sugar in it. If I take out your eyes, your kidney, and everything, and I soak it in that water, the sugar is going to permeate into your organs. The quicker I can get you out of that water, that sugared water, the less the risk of the sugar going into your actual system. So when we're trying to throw medications at you, we don't throw it, or prescribe medication, it is because we're trying to take you out of that, or your organs rather, out of that bucket of water. We're trying to stop things like chronic kidney disease, which is another topic that we're going to talk about, the kidney function, because you don't know what your kidney is doing. It's inside your body. It's not telling you, Folu, I'm reducing in my filtration rate, help me. It's actually going down and you don't know. And by the time you come to us, there is a problem. So we're here to help you, not judge you, not do anything. We're here to help you. So please use us in moderation. Use us. So I'm going to ask any last words because I know Elloiuse got to go. Michelle, Folu, Elloiuse, I'm really grateful for your time today. What are your final words to everyone on here and people who are going to catch up much later within our world? Any final words?
Yeah, so I'll kick off. I would just say, love yourself. That's really important. Love yourself enough to go for the walk, that Michelle was talking about at lunchtime. Love yourself enough to ensure that you're eating, 5 portions of fruit or vegetables. Once your cup is full, once you can look after yourself, you're going to be amazing to be able to do all the things that you want to do. Diabetes isn't the end of the road, okay? With some effort and some work and some good foundational knowledge, you can live a healthy life, and in some cases we can help you to reverse it or put it into remission. Sorry, not reverse it, put it into remission. If you are successful putting it into remission, please remember, still continue with the positive things that you've been doing. Don't stop. I know that there's been a few questions that have popped up while Tonye was talking about keto. Happy for anyone to send me a message about it. But in long or short, I would just say really it's all about following a healthy, balanced diet. It could be making adjustments to your macronutrients, so your carbohydrates, your protein and your fat. However, I wouldn't want somebody to just live on a block of cheese and bacon and things like that, because that's going to bring other health conditions along the way. So please, I wouldn't recommend that. But love yourself and work towards a better you.
Yeah, I love that.
Michelle?
Yeah, I would definitely just to say thank you so much to the panel. Brilliant. I love it. I love being around amazing women, amazing people that have a very similar mindset as well. So I would encourage the audience again to surround yourself with people that have a positive mindset, a growth mindset. Don't be closed, don't be saying, oh, I can't do that because no. Those days are done, guys. Yeah, this is for us now to unify, to change the narrative, and to look out for ourselves. We've seen too many of our own culture pass away too easy through ignorance. Let's not be one of those. Thank you.
Thank you. Folu?
Oh, I want to say thank you as well. Thank you to the panel. It's been really lovely, being on this panel with you all. Thank you, Tonye, for putting this together again. Hopefully there'll be more, as the months go by in 2022. I want to say, let's take ownership. Let's do away with the old traditions and old cultures. There are lots of strong African, Afro-Caribbean voices speaking out, you know, so let's be a part of that change. Let's do away with the stigma. Let's do away with all the, you know, old beliefs and traditions that do not help us. Let's reach out for help. It's in every area of medicine, even childbirth. Outcome for Afro-Caribbeans and Africans is poorer. Why? Let's speak up, you know, let's take ownership. Let's ask for help. Diabetes Consult is there for you. Elloiuse is there, you know, Michelle is there, you know, let's reach out to people that are in our community that are doing all these amazing, wonderful things. We can do it, you know, we're strong, we're determined, and we're able. So let's work together. Let's reduce this risk for ourselves and for the future generation as well.
Right. Yeah. Thank you so much. I would like to say thank you to all my speakers. Michelle, I'm really grateful for your time. I felt the connection, someone connected us, and thank you for actually just saying yes to me. You know, I did a beautiful smile, so obviously she had to say yes. But no, but thank you for saying yes. I'm gonna go to Folu. You know, you and I come way back, so I'm coming to your house for dinner. She just lives across the street, and let me have those vegetables on the side. Elloiuse, my heart, thank you so much. Elloiuse and Folu are a part of, you know, like we're all part of the Diabetes Consult team, and we're here to bring information to our people to liberate us. Liberation, God has sent, you know, I'm a Christian, I'm not ashamed to say that, but we have been sent help. Let us please use the help that we've been sent. Let us get the information that we need. Knowledge is power. And with power comes liberation. You know, when you're empowered, you're liberated. So let's get the information. Let's not be judgmental towards one another. Gosh, you have diabetes. Your own is doomed. In the Nigerian way. No, that's not a language to use. Or the pity party, hey, yeah, you got diabetes. You know, but it's actually you getting understanding so that you can support people who live with diabetes, not from a judgmental way. So, and I want to say thank you to everybody who is actually taking time out to sit here for more than an hour to listen to us. We really appreciate your time. Thank you to my husband, because he's across the way making everything work, you know, and just thank you to everyone. I really appreciate you. Whatever you're doing this evening, enjoy your dinner, whatever is on your plate. Just open a cupboard, like Elloiuse says, and see, is the right portions in there for me? We're not judging you, we're just making you see clearer. Yes. Have a very good evening, everybody. Oh, and the book is Carbs and Cow World Foods. It has all the different, you know, the different nationality in there. You can get it on Amazon. We don't have any commission towards it. We're just helping you to get it. Have a good evening, everybody, and thank you so much for your time. Bye.
Well done, Tonye. Amazing. Thank you so much.
Thank you for doing this.
Bye. Well done.